The head of the World Health Organization says containing the transmission of the coronavirus is key to prevent the virus from mutating further. The warning came during a briefing on a new mutation of the virus found in several countries, including the UK. It's reported to be more infectious, but has shown no evidence that it is more deadly. The new variant has prompted dozens of countries across the globe to close their borders to travelers coming from the UK. In the US, officials are clashing over how the situation should be handled as Americans nationwide prepare for holiday gatherings. So Mola Lenghi is at Newark Liberty International Airport, where travel is ramping up.
We have been victimized by federal incompetence and federal negligence. That is
harsh words from New York Governor Andrew Cuomo as he fights to keep a mutant strain of coronavirus out of the United States. British scientists said Monday that strain is up to 70% more transmissible. Now, there's no evidence that shows the new strain is more deadly. Still, former FDA Commissioner Scott Gottlieb believes at this point it's too late to stop it.
I think this is already in the U.S. I don't think the travel ban at this point is going to prevent this mutated strain from coming into the United States.
That has hospitals already pushed to the brink, with COVID patients even more on edge.
If it were to be the case that this virus would spread more easily and infect more people, that could make the burden on our healthcare systems even worse.
But more help is on the way in the form of a second COVID vaccine.
It was very exciting.
Dr. Caitlin Jones, medical director of the ER at Christ Hospital in Jersey City, New Jersey, was one of the first to get the new Moderna shot.
We're going to feel a lot more comfortable when we walk out of the hospital and we're not wearing PPE at home amongst our children and family.
A new USA Today Suffolk University poll shows a growing acceptance to take the COVID vaccine. 46% of people said they would take it as soon as possible, nearly double from October. President-elect Joe Biden received his first dose of the Pfizer vaccine Monday in the hopes of getting those numbers even higher.
People should be prepared when it's available to take the vaccine. There's nothing to worry about.
Well, it is worth noting that it is common for viruses to mutate. Pfizer said in a statement that its vaccine has been tested to protect against multiple strains of this virus. And now it's just gathering data to see how effective it is against this specific strain in the UK. Mola Lenghi, CBS News, Newark, New Jersey.
All right, Mola, thank you. For more on this, let's bring in Dr. Dyan Hes. She is the founder of Gramercy Pediatrics. So, Doctor, we just heard in Mola Lenghi's piece there that New York Governor Andrew Cuomo is calling for a ban on travel from the UK because of this new variant of the coronavirus. Several European countries have already imposed travel restrictions on individuals coming from the UK. But I got to ask you, should the U.S. be doing the same? Does it make a difference at this point? The governor was also sort of trying to get certain airlines to make people take a coronavirus test before they got on the plane. Do you think that would make a difference either as well, I suppose?
I think testing definitely would help. I think that I have a feeling it's already here, is my guess. I mean, we've had people coming from the UK for the past few weeks. So why would this virus not jump on the plane with everybody in their blood, and in their respiratory secretions? But I do think that maybe a temporary travel ban until we get a better hold on this right now might be wise. The truth is we really shouldn't be traveling abroad unless it's an emergency, like a death in the family or something, somebody's very sick. I think that really tourism should be at a halt right now, because the truth of the matter is England is on lockdown. So what are you going to do? And do you want those people who have all been exposed coming here? And we really don't want people socializing, being in big groups, doing these Christmas celebrations. So encouraging tourism really goes against being safe right now and staying at home. So I don't think a travel ban would be the worst thing.
We've heard sort of different phrases being used: variant, mutation, strain. British scientists are looking at whatever this is, this variant of the coronavirus, and whether or not it spreads more easily in children. Do you know anything about that?
Well, I read the articles. It's just a theory. Nothing has been proven yet. They're just trying to study and see why it is spreading so fast, but it's absolutely not true that it spreads faster through children. That is just one of the theories that they're looking at. So I wouldn't say that with confidence. I think that that's just something. There's so much new science. We can't keep up. And with this new mutation, they're just trying to find how come and why it's spreading. But the numbers aren't higher in school-age children, and right now there's no proof that children are spreading it more.
I remember earlier in the pandemic, we had talked about something that looked very similar to Kawasaki disease showing up in children. And now, according to California's Department of Health, as of last week, more than 150 children in the state have been diagnosed with this coronavirus-related multi-system inflammatory syndrome. That's what they're calling it. Can you just sort of remind our viewers, what that is all about, how it's linked to COVID-19? Is it something serious that parents should be looking out for?
Yes, this is definitely a serious complication after coronavirus. So the problem is that most children don't show signs of coronavirus, so they were asymptomatic, so the parents don't even know that they had it. We do know that that it's definitely more prominent in Black and Latino communities and the children. Obesity is definitely one of the largest risk factors for developing this severe syndrome. They get high fever, red eyes, rash, extreme fatigue, and gastrointestinal system problems. And that's something that parents always forget, that could be coronavirus. They think of coronavirus like a cough and a runny nose, but about 47% of coronavirus has gastro involved. So you could have diarrhea, vomiting, severe stomach aches. Their kids look very, very sick. And this is not something to be taken lightly. You want to seek medical attention immediately. A lot of families are afraid to go to the hospital because of coronavirus, but this actually means that your child already had coronavirus. So they're not going to get coronavirus again, but they will need to get treated in an intensive care unit if they have this. And they need to have labs done that cannot be done, at a regular clinic. Usually you have to go to a hospital for those kind of labs.
Now, as we've spoken over the length of this pandemic, we've talked a lot about kids in school versus virtual, and I know that you support the idea of kids being in class and doing it as safely as possible. You think that's kind of like the best way for them to get an education and all the other things that they get when they are in school that they're missing now. But we know that kids are out of school for the next couple of weeks. We've been talking a lot about how people are gathering, even though the recommendation is that they don't, but the expectation is people will gather. They will gather with other households that they normally don't interact with. How concerned are you about a flare-up of the coronavirus showing up in schools once kids return?
I am, and I think that's why we need much more testing that's available. I think school-age children should be tested every single week because they're walking around asymptomatic, they feel well, they're going to school. But I do still have to say that studies show that being in school is 15 times safer than not being in school because you're in a contained pod usually, and you are in a smaller classroom with 6 feet distance apart, and you're wearing your mask. Whereas at home, if your parents have to go to work, they might leave you at your neighbors. You might go to your grandparents. So it's much safer to be in school with a mask than to be home trying to entertain yourself, doing online school, hiring a babysitter that you don't know where they've been. So school is the safest place, but we do need frequent testing, and we just don't have that capability right now. New York is ahead of the game, but for most states, that school-based testing is not readily available.
Officials at the National Institutes of Health, they're launching a study into that rare but severe allergic reaction that some people have experienced when they got the Pfizer vaccine. What exactly are scientists hoping to learn from this, and how long could it take for us to get answers?
Oh, I think it's going to take quite a while, but there's one theory that it could be the polyethylene glycol in the vaccine that's causing the allergic reaction. I am not an allergist. We just know that people who've had previous severe allergic reactions have very few have had anaphylaxis. It's very treatable. They get epinephrine. Most of the people who had anaphylaxis, I know in the UK, actually had an EpiPen on them because that's how reactive they are. But it's just something we'll have to study, and it's not going to be solved in a day or two. It's going to take weeks to months to figure this out.
Finally, there's a new analysis by researchers at Harvard and Brown universities conducted for NPR, and the analysis found that the U.S. may finally be close to doing enough testing to identify most people reporting symptoms and at least 2 of those close contacts. However, the analysis also found that the country should be doing about 3 times more than that. How vital is more widespread testing, and what needs to happen so we can actually reach that goal?
Well, I just think the distribution. So I can tell you that I bought 4 Abbott machines way back in August to do the Abbott ID Now test. Since then, I've only had 48 cartridges to do 48 COVID tests. I spent my life savings on it. And this week, I'm only getting my next shipment. So it's not there. You know, they sold us a bunch of bull, actually, because doctors have shelled out tons and tons of money. But the tests are only going to certain big chains. And the lines, like in New York City, the lines at CityMD or that urgent cares are 2 or 3 hours. So if you think that you might have COVID, do you want to stand in the freezing cold, possibly rain and snow for 2 to 3 hours to get COVID tested? You're not feeling well already.
Yeah.
So how is that a feasible option? We need more tests to be sent to us, and we need them to be affordable, and they are not. And this is why the spread is going to go on, because the testing is just not effective. We cannot, doctors are dying to do the tests, and we cannot even get enough tests to be done.
Dr. Dyan Hes, that is really interesting and important information, and maybe it might be something worth talking about just on its own. Thank you so much for joining us this morning.
Take care.